And now, for our first session, Dr. Daniel Kraft is a physician scientist with more than 2 decades in clinical practice and biomedical innovation. He's chair of medicine at Singularity University and founder of exponential medicine. He promised me he would explain what that means. And there's a good story about him. He invented the marrow miner. Several years ago, Dr. Kraft was performing a bone marrow transplant when he realized that the 200 holes he just drilled in a patient's pelvic bone were not necessary. And that eureka moment led him to create technology which made the same procedure much less invasive and allows for the collection of 10 times more stem cell samples. It's my pleasure to introduce Dr. Kraft to talk about the future of medicine and answer the question, where can technology take us? Dr. Kraft, the floor is yours.
Thanks. Thanks very much. It's a terrific honor to be here and sort of kick off this amazing morning where we're going to look at some of the realms and roles that technology can play in reshaping and reinventing the future of health. And of course, technology is not working. My clicker's having issues. It's always a classic, right? Let's see. Wow, this is not going to, let's try unplugging this, plugging that back in. So we have a saying at Singularity University, AI is easy and AV is hard. But I'll start off while this is hopefully kicking out. There we go. That technology is really shifting many parts of our lives, and particularly as an opportunity to impact healthcare. And I'm going to try and take us quickly in 20 minutes or so through some realms of where technology is taking our own health and prevention, the future of diagnostics, therapy, and even our role in discovery and participatory healthcare. But often, you know, many of us experience in our daily healthcare experience that sometimes it feels like while we're looking into the future, we're sometimes still back to the future. After medical school at Stanford, I trained at Mass General Hospital. I was back there recently for a reunion of our house staff. It was the 200th anniversary of MGH. And I was kind of shocked to go back to the ward where I spent my first month as a terrified young intern almost 20 years ago, and to see that that home hadn't almost changed. You know, same alarms were beeping, some of the same nurses, some of the same patients. And while the intern was pushing around a laptop and typing at the EMR and printing it out and putting in the paper chart, the front desk is still using the cutting-edge medical communication tool of our day, the fax machine. And that kind of epitomizes the fact that in some ways we're still thinking in old ways, old silos, old definitions of healthcare, and we have the opportunity to think outside the box of old subspecialties and body parts as we reinvent the future and move from our era of sort of sick care to an era of true healthcare. And an era where we have sort of intermittent and reactive medicine, intermittent meaning occasional blood pressure check, an EKG once a year or so, faxing your blood sugar or blood pressures to your clinician, leading us to a reactive era where we wait for the heart attack or the stroke or the lump to be discovered at stage 3 or stage 4, where we still wait 36 minutes on average for our 12-minute visit, whether we're here in Phoenix or in Calcutta. So we have the opportunity through technology to shift things. But technology is, of course, just one part of that. As many of you know, it's the incentives and the system and the culture that's so critical. Today, as most clinicians, you know, and as in my practices, we're still sort of fee for service. We see a patient, we get paid for them. We're incentivized to do reimbursement-based medicine, not evidence-based medicine. But the incentives are shifting with accountable care, value-based care. We're going to start getting paid to keep our patients healthy, and drugs and devices and apps are going to get paid for when they work. Another big meta trend is where's healthcare happening? Traditionally in the ICU, the ER, in the clinic. And now technology is taking that out of the traditional setting into our homes and even onto our own bodies. And our corner pharmacy, where they're battling to be your site of primary care. So the trends are shifting. It's no longer the doctor being the god and you go to them and they tell you what to do. Now you are the empowered patient, the empowered consumer to own your own healthcare, to be able to own your data, to be able to share it, to be included, and to contribute to the whole process of discovery. Another meta trend is the consumer having transparency. We can rate individual hospitals. We can log in and compare one drug to another. And a lot of these new shifts are being transformed by exponential technologies. You all know Moore's law, the power of computation, as epitomized by computing speed in our pocket. You know, our smartphones now have 1 billion times the price and speed and performance of a supercomputer from the 1970s. Your tablets are more powerful than a Cray supercomputer from 10 or 20 years ago. And these are examples of exponential technologies. Our brains think linearly, but exponentially. If I take 30 exponential steps, I'm around the planet 26 times. And I want you to start thinking about where the puck is going exponentially, because that's where the opportunity to shift healthcare is occurring. Not just in sort of our computers. I mean, as you're epitomized by, you know, the computer from 2000 now fits in our smartphone, now fits in our smart watch, is now shrinking to computers the size of a grain of rice. and all of those are starting to be connected now, the Internet of Things coming to the Internet of the body. We're seeing disruptions and dissolving of technologies. You don't buy what used to be $500,000 worth of technology. You download it as a mobile app. So we're in this connected age, this mobile age, this age of digital health. A bit of a buzzword. I think all these will soon just be called health. You don't call it digital movies or digital banking anymore. But that sort of mindset of shifting things, not just through Moore's law, but through the convergence of all these technologies as they come together. The mashup is where we have the opportunity to address many of the grand challenges we have in healthcare, whether it's the aging demographic, 19% of our GDP in the United States. Even with Obamacare, we have much more folks covered by care, but a shortage of physicians and nurses in many parts of the country. We have lots of big data coming at us, but how do we make that useful, actionable information? And while technology is moving quickly, sometimes our friends at the FDA, the F word sometimes, is they have trouble keeping up with exponentials, as do our friends, some of you are here, the payers. How do you have the hammer on? How do you reimburse and stimulate using some of these new tools? So our challenge is to reimagine. Just like Uber has dramatically disrupted the travel world, we have the opportunity to Uberize elements of healthcare. In fact, Uber themselves did a pilot last year with Uber Health. You'd slide it over, press a button, and a nurse would come and give you a flu shot. And several other companies are bringing back the house call. Press a button on the app, and a doctor comes to your home within 3 hours. Not sure what kind of doctor, but you get a doctor. And remember, there's transparency. They can rate you, and you can rate them. So that kind of mindset's coming, and we're sort of expecting it. So disruption is coming to our friends in pharma, our friends in the payer world, to consumers and beyond. And it's our opportunity to be the disruptors, not the disruptees. So I get a chance to sort of live in this world, chairing the medicine track at something called Singularity University. It's based in the heart of Silicon Valley. It's been around for about 7 years. I've been there since the beginning. I chair medicine, but there's tracks in biotech, robotics, AI, 3D printing, space, energy, IT, and beyond. And we look at where's the convergence of technologies, how do we apply those to addressing grand challenges in the world, poverty, education, healthcare, environment. And in our 10-week summer programs and our short executive programs, about half of the new projects and companies that have evolved from people even outside of medicine traditionally are addressing healthcare. Check out singularityU.org, lots of opportunities to participate there. And because healthcare is being reinvented from different spectrums, about 5 years ago, I founded a program called Exponential Medicine, where we bring physicians, patients, IT folks, investors, all sorts of folks together to look at how do we reinvent and reimagine the future of healthcare from all sorts of different angles. So we've now grown. We hold this every fall at the Hotel Del Coronado in San Diego. And again, it's, I think, when you bring different people together where the magic happens. And of course, we took our group picture by drone this year. Okay. So let's look at a few examples of how reinvention is already happening from a few different angles. First of all, health and prevention. We know that our genetics are important, but it's our behaviors that are much more impactful in our long-term health, happiness, and healthcare costs. So if we can tweak our behaviors, that can drive and reduce chronic conditions and decrease all the costs and trauma we have from chronic illnesses, whether we're here in the US or elsewhere. And we have new ways to tap into our behaviors now. We're in this world of connected wearables. How many here have a Fitbit or something else? I'm wearing like 4 different versions, right? How many have had one and lost it and don't have a charger, right? Well, we're moving from this era of sort of risk-based, sort of quantified self to, I'd say, quantified health. These technologies are starting to infuse and will have a huge impact in healthcare. As these sensors leave our wrists, we're moving from sensors 1.0 to 3.0. Sensors in our pills, in our cars, in our swim caps that can trap our swimming. Moving from wearables to insidables. Companies like Google now developing contact lenses that can track blood sugar and partnering with big pharma to bring that to market. And moving not just from insidables to this idea of even trainables. Wouldn't it be nice to have feedback? For example, something when our smartphone here, our postures aren't very good, and your mom wasn't there always to nag you. What if you had a little device on your back that buzzes your back and reminds you to stand up straight? These are now on the market and can play a role in improving something as simple as posture. Or shockables. Pavlov was onto something. Do something wrong, boom, right? Or rings now that can track your motion, sleep labs on your wrist as you go to sleep, or embedded into our clothes, into our cars, starting with the sports world, but will be embedded into heart failure patients and others. Or in the pediatric world, and I train in pediatrics as well, this used to be the future, the connected diaper. Well, not the future anymore, because Huggies last year came out with Tweet Pee. You can figure out what that does. There's also, of course, data for number 2, sometimes too much information, I would argue. Connected onesies can allow us to send children home from the intensive care unit earlier. Here's my son Leo about a year ago doing his part for medicine. Didn't need that to tell me he's waking up every 2 hours, but you can see how these are going to play a role in infusing healthcare, from connected binkies to ways we can track our quality of our breath. This device can track your blood alcohol level. If it's too high, locks you out of your car, calls you an Uber. But the new version will track the quality of your breath. Is it bad or not? How well hydrated are you? Soon, other versions, like nano noses, will pick up and diagnose things like lung cancer from your breath alone. There's now Wi-Fi, published by MIT last year. Wi-Fi can pick up vital signs from multiple people in the same rooms. And all this matters when it becomes personal. My friend Brett had a traumatic brain injury a couple years ago, was completely in coma for weeks, slowly started walking again, has an amazing recovery, but using wearable devices, he now tracks and shares with the social network his steps every day in his sleep. He's at 8 million steps. He does like an average of 8,000 steps a day. So these can really empower both recovery, health, prevention, and beyond. And so we're going to be entering an era with our digital exhaust where we're going to be always online. It has good and bad sides to it, but has lots of opportunity. Because just in the last year, Apple, Google, Samsung are allowing this data from our wearable devices and our Internet of Things to flow into our medical records, just the beginning of this. And of course, we don't want to log into 10 different apps and have all sorts of data streaming at us. We want to integrate this. What does it mean? How about like a FICO score for your health to integrate this and make sense of it from all sorts of elements, your financial health, your social network. All these play a role, not just your vital signs or lab tests. Because we don't want just the data, we want to understand where it's taking us. I like to call this predictalytics. What do these trend lines mean? As we're in this era of machine learning and big data, we're going to enter an era where, just like our modern cars, you don't care about any sensor, you care about when your check engine light goes on. And I think we'll see an era of, these are going to be commoditized. We'll see kind of OnStars for the body, which are going to guide us and say, Daniel, take a right and go to the gym and do your yoga class, not left to the fast food restaurant. And it's going to give me nudges along the way. And we can already see smart AI coaches evolving, like this app called Lark, which tracks you. It's kind of like the movie Her. It's kind of interactive. It tracks you, gives you encouragement. It knows when I haven't had a lot of sleep and can buzz me and kind of coach me along. These are starting for health and wellness, but will move into chronic disease. Or what if your coach was embedded in your mirror in the morning and you woke up and you saw future you? Future you if you were working out and doing your diet. Future you if you're doing your P90X. Future you if you kept having donuts for breakfast. Future you, right? That could be a smart coaching element, and you can download apps today that see you here now. Here's me, and here's me 1,000 donuts later. Changes my perception in the morning, my behaviors. Because we all know we're supposed to exercise more and eat less, but behavior change is hard. So if you can coach a patient and show them what their skin's going to look like if they keep smoking, that can be powerful. So this is bringing and blending the world of technology and augmented reality. We're already into the world of augmented reality. You all know Google Glass is already kind of antique, but it has an important role to play in healthcare, from enabling us to surgeons to do smart things in the operating room. HoloLens coming out from Microsoft is being tooled with anatomy lessons now, so they're already partnering with Case Western to allow medical students and others to see things in an augmented reality way. All sorts of ways these are going to blend into our world, even using things like Google Glass to take kids with autism, enable them to see their environment, interact, and learn cues about is their mother angry or not, using the lens through augmented reality of a glass platform. So lots of things are going to transform that world. I was just at the TED conference last week, had a mind-blowing demo of this meta augmented reality system that's going to enable us to throw away our computer screens in a few years. Really dramatic shifts happening there. And we can apply them to healthcare. Not just virtual reality for gaming that are expensive, but low-cost versions on your smartphone and Google Cardboard. Ways to take these in the operating room, so you're there, just like the surgeon or the medical student, you can see everything in real time. Lots of ways these will transform things, including in our sports and prevention realm. You'll be wired up and connected in a new world. So watch that space. Another exponential that's happening is clearly personal genomics. It used to be millions of dollars per genome. Now we're dropping the rate of sequencing to about $1,000, soon to be a $100 genome. What happens when you present to your doctor with your genome on a disk drive? Still challenges, but lots of opportunity. Your pharmacogenetics, how do your genes impact your drugs, are really important. You can do that from a $99 23andMe test today, for example. Old school technologies can play a role in our health, meditation, yoga, and we have now new ways to see their impacts on our brains and our bodies. We can use now off-the-shelf technologies, brain-computer interfaces, to look and optimize our ability to do mindfulness or meditation and prescribe apps to folks who might have anxiety or depression and just encourage them to meditate. Or use these for kids with ADHD. When they learn to focus, the game goes and they can get off their drugs, disruptive to some pharma models, for example, for kids and for adults. Or versions that'll buzz your brain, for example, and provide the ability to boost it up or calm it down. Lots of ways we're going to start hacking our brains. And even in the advanced form of brain-computer interfaces at my alma mater, Brown University, we can now have quadriplegics, for example, controlling a robotic limb just through the power of connected brain-computer interfaces. If we take this a step further, gaming can be very powerful to impacting our normal brain state and even improving it. Our ability to multitask. Playing video games on a smart tablet is now evolving to an area where you're doing that with like an Xbox, and we can rewire our cognition in very powerful ways. So watch the gaming and health space. How about the future of diagnosis? We want to pick up disease early. I'm an oncologist. We want to pick up disease at stage 0, not stage 4. We have new tools, microscopes that can be used in the OR in real time to do pathology. We're shrinking and digitizing pathology in many ways. The digital doctor bag is emerging. You know, you can send someone home who's got an ear infection with their kids, and they can do an ear exam through their smartphone case. Or we're now seeing an analog stethoscope now be digitized. It can listen to the heart sounds and do a better job than I can, or a trained cardiologist in picking up heart sounds. We can integrate a whole slew of medical communication devices and diagnostic devices into a single unit. Or a smartphone case, again, can play a role as a digital dermatologist. Take a picture, send it to a real dermatologist, or soon the apps themselves are doing a better job of just recognizing, you know, kind of through military-type technology, is that a melanoma or a mole? And the AI dermatologist will disrupt the dermatology field. The pocket ultrasound used to be a $100,000 case, has shrunk exponentially to something you can plug into your smartphone and Facebook your ultrasounds if you like. The old school eye exam is now stuck on a smartphone and can be distributed easily anywhere around the world. Or even now the EKG, you know, what you used to go into is now on a smartphone case, something you can distribute anywhere. This is on Amazon. You can buy it for $40, FDA approved, over the counter to do EKG. I could screen everybody here. The new version here is even on your, this is still a prototype, on your watch. So an EKG anywhere might be helpful for triage, for a AFib patient, and beyond. I'm actually wearing a patch now from a Bay Area company called Vital Connect. I'm wearing it on my shirt, streaming live to my smartphone. Let's see if I can show it to you. We'll see how stressed I am. It's showing my real-time EKG and other data, and it's an example of what you can do. An ICU, basically, on a patch in your pocket, can be streaming my data anywhere in the world. And this will be in our hospitals everywhere. Look, my stress is only 98%. Thanks, guys. Useful information. The trick is, what do we do with it? And once we have that data, we pick up heart disease. Do you want to do an angiogram? We're moving now to digital diagnostics, a 30-second CT scan, send your data to the cloud, do computation on that, and be able to compute how narrow is that blood vessel. Do you need a bypass or do you need a stent? Maybe we'll even 3D print that stent to match the patient's individual anatomy. So new ways we're going to be blending and converging computation, imagery, et cetera, to do smarter diagnostics. So some new things in healthcare need new incentives. I've been involved with the X Prize for several years. We formed a $10 million X Prize to incentivize teams to build an actual real medical tricorder. And over 400 teams entered this competition. We're in the top 10 right now. One of them started at my future medicine program, a company called Scanadu. They've now shipped 10,000 of these Scanadu Scouts, a medical tricorder type device you hold to your forehead, picks up your temperature, your heart rate, your O2 sat, calculates your blood pressure, talks to your smartphone that's connected with IBM Watson. And they've collaborated with the FDA to ship these as part of a clinical trial. They've also been developing smart diagnostics, for example, for flu season, spit in a tube, or dip your urine at home and use your smartphone and app to do the diagnostics and send that information to your doctor, to the CDC, to the NSA. Who else wants the information, right? And they crowdfunded this clinical trial online. So new innovations by crowdfunding are coming along. So the point of care lab test is here. The ability to complex elements in almost any location is evolving. Even paper-based tests, whether it's for Zika virus or Ebola, are emerging for global health. And of course, with all this new data, whether it's wearable data, diagnostics data, how do we make ourselves smarter? Our brains haven't had upgrades in hundreds of years. We need new forms of AI, or I like to call it IA, intelligence augmentation, to start making sense of this. And as IBM Watson and others are collaborating with Medtronic, Apple, J&J, beyond, it's going to start infusing our healthcare system to, again, enable us to be more proactive, to pick up elements early, stage 0 or before, to intervene before we end up with advanced and chronic disease. Of course, privacy is an issue. Things like blockchain and Bitcoin can be used to leverage this in there. And technology and privacy are important, but still that patient-doctor relationship is even more critical. And I think technology can get out of the way and help enable that important relationship as well. In the last few minutes, let's look at the future, let's say, of therapy, right? Therapy is moving in interesting ways. Gene therapy now with CRISPR and synthetic biology will be curing diseases soon, like sickle cell disease. We'll take out some bone marrow, replace the bad gene, retransplant it in. It's already been done in a few patients. Personalized oncology is coming. Every tumor will be sequenced. We'll use AI and big data to make the right cocktail. We'll replace the upper endoscopy, big scopes going down different directions, with pills you can swallow. These are already on the market that can do endoscopies remotely, or pills that can swallow and track when you've taken them, or others that will infuse IV drugs into your gut as opposed to in the IV form. We're in the era of electroceuticals, implants beyond just a pacemaker, but pacemakers for your brain and for your gut. Even remote control pacemakers, or those for contraception, which might lead to some interesting conversations. Honey, you know, where's the remote? Or what if someone hacks your remote or hacks your pacemaker? Interesting questions. We're in the era of telemedicine. There's several apps you can download and do real-time telemedicine visits, sometimes in real time or sometimes asynchronously. So all these things are set to shift how and where healthcare happens. I was in a story a few years ago from The Atlantic on the robot will see you now. Robotics is playing a role in the operating room, delivering drugs. Robotic anesthesiologists are here. We're seeing robots in our homes to clean your floors and do telepresent visits. We're seeing robotics that are wearable. The woman in that upper picture there is paralyzed from the waist down. She's wearing an exoskeleton that enables her to walk. And you can see the components there. Some of them are 3D printed to personalize and match her exact anatomy. And so 3D printing is another area that's really going to reshape healthcare, from replacing the old-fashioned cast to one that matches you and your specific anatomy. Might be printed out in the emergency room for you in real time, or let your kids run on the beach, or make a scoliosis brace, or personalized implants for orthopedic procedures. Patients are starting to use 3D printing. My friend Stephen Keating, an MIT postdoc, diagnosed his own brain cancer and helped his surgeons do the operation by 3D printing his actual tumor, and he gave me a real-size, life-size copy. So new ways we can apply that. Or one of our Singularity U companies sent the first 3D printer to the space station, when you might be able to 3D print a medical device, which is hard to get there, when you need it. You can obviously 3D print yourself. There's Mini-Me. I usually carry him with me, which might be helpful if a patient is missing part of their face to make a prosthetic. New ways to 3D print pills to replace piles of them are emerging. 3D printing organs is in its early stages. It was mentioned, and that uses stem cells. And mentioned in the introduction, when I was a bone marrow transplant fellow at Stanford, unmet need is a key area. I had a problem of having to do lots of bone marrow harvest and thought, why do 100 holes when you could make a device, which I invented, called the marrow miner, to do a single pass, kind of like a roto-rooter for your bone marrow. And that's now FDA approved and getting commercialized to enable us to do rapid bone marrow harvests and enable that for bone marrow transplant and regenerative medicine. It's the marrow miner. Even drones can play a role in healthcare. Another Singularity U company is applying drones to deliver drugs and vaccines in difficult places, or drones to deliver defibrillators. And coming to market in the next few years will be personal drones, self-driving drones that can take you around, or even ambulances to pick up and deliver patients that are drone and remote and flown. Last 2 minutes. Discovery. We want to improve the pace and lower the costs of clinical trials and beyond. Still $1 billion, 10 years per drug, most fail. What if you could now download an app that'll enable you to do a clinical trial? That's already here. Apple Research Kit launched last year. For example, a Parkinson's app. Download the app, do your consent forms, your speech can be tracked, your tremors can be tracked, all through the smartphone. That's going to democratize healthcare. That's going to allow us to crowdsource clinical trials. Just like when you drive with Google Maps or Waze, and here's a map of Rome being built in a day just from driver data, we could apply that same sensibility to healthcare. Where's the roadblocks? Where's the bad traffic? Where's the cop hiding out? How do we crowdsource and donate data, not just our blood and our organ, become data donors as well, and unleash the silos that are now blocking a lot of this information? And finally, a lot of this takes not just technology, but smart design. I love aviation lessons, since I've been a flight surgeon in the Air National Guard for several years and get lots of time flying in fighter jets and taking care of fighter pilots. Those same sensibilities are applying to medicine. Checklists to improve operating room safety. Simulation, just like our pilots. Simulation for almost everything, from a cath procedure to training medical students. Simulation for everything, really. Some things are better in this form. Air traffic control to see where everybody is and to have situational awareness. Where's the infection breakouts and beyond. So in wrapping this up, as we move into inventing the future of healthcare, I want you to think like Wayne Gretzky. Realize that things are exponential. The puck is here today, but it's moving very, very quickly, and you want to skate to where the puck is going to be, not in 2016, but where it's going to be in 2018. And realizing it's this convergence of all these different fields, AI, big data, 3D printing, sensors, genomics, and beyond, where I think a lot of the opportunity for reinvention is occurring. So let's move from an era of episodic and reactive healthcare, that's sick care today, to a real era of healthcare, proactive and continuous, and realizing we can take exponential steps. The future's already here, famous quote, just not evenly distributed. And I think any of us, whether we're patients, consumers, pharma, anyone in this audience, we have the opportunity not to just predict the future, but go out there and create it together. So with that, I'll say thanks very much.